Hello, this is Dr. Wells with Wells Medicine, and I wanted to talk about stellate ganglion blocks and insurance. Stellate ganglion blocks are a very, very old nerve block that has been practiced for a very long time with some uses that are covered by insurance. Stellate ganglion block has an insurance code and is covered for complex regional pain syndrome of the upper extremity, vasoplegia of the upper extremity, which is sometimes more commonly known as Raynaud's syndrome, which is where your nerves tell your blood vessels to constrict very tightly, and then patients will see white or blue fingertips, and it can be very painful syndrome. You can also use the stellate ganglion for claudication, which is where there's a blood clot or a narrowing of the arteries, which can cause pain in the upper extremity because of decreased blood flow. Similar to the pain when the blood pressure cuff pumps up really tight and your arm gets super sore and stiff, that is like a vasoplegic response. Stellate ganglion block can be used for the arrhythmias, supraventricular tachycardia, and it's very well known for helping to alleviate SVT that is refractory to medications. So that's another indication that is covered by insurance. But unfortunately, PTSD is not a covered diagnosis that is covered by insurance at this time. I think the more that patients demand and ask for coverage for stellate ganglion block and the more research that we're able to do, the more it will be covered in the future. And certainly I always advise patients, if they've had treatment for their PTSD, to discuss with their insurance providers. Generally, our treatments at Wells Medicine are very cost effective relative to other treatments for PTSD that your insurance company would pay for. And generally, the motivator of an insurance company is saving money somehow. So we have some foundations that are covering stellate ganglion blocks for veterans. There are some VAs and TRICARE based organizations that are covering it. So it's really just a matter of working with your insurance company. We're happy to provide codes and forms for insurance companies to try to get it covered as much as possible.